Just say, hey, you're listening to Cult of Reason. Just say something like that.
I can't do it right now.
I believe virtually everything I read, and I think that is what makes me more of a selective human than someone who doesn't believe anything.
Cult of Reason.
We're all monkeys.
Apes don't read philosophy.
Yes, they do, Otto. They just don't understand it.
Cult of Reason.
The only true wisdom consists in knowing that you know nothing. That's us, dude.
I anticipate a deeply religious experience.
Interesting way to open up a conversation.
Hello, everyone. Welcome to Cult of Reason. This is Mark Pankinen, and this episode is about stem cells. So I've had shoulder pain now for about a year, just kind of dull, annoying pain. Not that big of a deal, so I haven't really done much about it other than wait and think it's going to get better. And it's been about a year and it hasn't gotten better, so I finally went in. I saw a good friend of mine I go way back to med school with, Tom Nabity, who is a PM&R physician, and he took out an ultrasound probe and showed me on my shoulder that I have a torn labrum in my right shoulder. And he suggested to me that I try using stem cells to treat this. I've heard a little bit about this. It's kind of new. It's cutting edge. It's still a little controversial as far as exactly how well it works and the protocol you're supposed to use doing it. And there haven't really been these big, well-controlled trials that are typically needed before it gets FDA approval. So it's still not FDA approved. But it sounded to me, after talking to him, like a very low-risk procedure, and I was willing to give it a try. And it wasn't painful enough that I would even consider surgery anyway. So I decided to do it. And we got to talking about stem cells in general and just all of the stuff that is being looked at right now. Almost any condition you can imagine has some type of trial with stem cells going on right now. And they're starting to show some very encouraging results. And there's even a more far-out application being studied, which is the idea that stem cells might be useful as a health maintenance intervention or preventative measure. In other words, it might be possible to use stem cells to prevent disease or prevent aging or even reverse aging. So we thought it'd be a good topic for a podcast, and we decided that Tommy would come in and be my co-host for this one. And for a guest, Tom brought with him a guy named Steven Clausnitzer, who is the CEO of a company called Forever Labs. So what they do is store your stem cells in case you ever want to use them in the future, depending on what kind of things develop with the science. So the way the process works is I go into Tom's office. He does a bone marrow aspiration on my posterior hip bone. He takes those stem cells and he spins them down, separates them out in some way, and re-injects them into my shoulder. And then he takes the extra stem cells, puts them on ice, and the guys at Forever Labs then take it and they store it for you. And their business model is basically your stem cells, the younger your stem cells are, the better. So store them now, and who knows what kind of application you may have or want to use them for in the future as some of the science works out. So both these guys did a really good job on this podcast. Sound very professional. Tommy sounds like if you hired a voice actor to sound like a doctor. That's what he sounds like. And he's got a very sharp mind, very precise communication style that really comes across. And Steven seems like a great guy, very dynamic speaker and communicator. And you can tell that he's really excited about his company and, the potential going forward for these stem cells. And although he doesn't have a science background, he clearly knows what he's talking about and is in real deep with this stuff. So he was super fun to talk to. And me, on the other hand, I sound like a stoner that just ate a Quaalude or something. I know I'm way harder on myself listening to these things, but just very monotonous and like mumbling. So it's been interesting and cringeworthy at times listening to all this audio of me speaking, but it's useful to try and figure out different ways of improving your speaking style too. And I guess it's part of the fun of this thing, kind of a self-improvement kind of deal. But anyway, had a good time talking to these guys. I just kept the recorder going from the minute they walked in the door because basically just came in and we started talking. So I didn't edit this one as much as I have in the past. So without any further ado, here is my conversation with Dr. Tom Nabity, who is the founder and medical director at the Michigan Center for Regenerative Medicine in Rochester, Michigan, and Steven Clausnitzer, CEO of Forever Labs. Come in. Hey.
Yo.
What's up, man?
Good to see you. Dan, Steven.
Steve?
Yeah. Nice to meet you. Nice to meet you. What's your name?
Mark.
Mark. Nice to meet you, Mark.
I'm gonna have to get one of those red lights, like the on-air lights, on the hallway. You know? Do not disturb. So, you guys want a beer?
Let me finish this first. But yes, after that I will. What time's Michigan?
I'll hold off.
You hold on?
Yeah, I have a long day of drinking ahead of me.
Okay. So, Tom, why don't you sit here?
Okay.
Steve, right?
Yeah.
Steve, or Steven?
Steven?
You go with Steven
Yeah,
or
Steven
Steven?
will work. Yeah, Steven.
Why don't you sit on that end there?
All right, cool.
Since you're my co-host this time.
Okay.
You working today?
I did.
You got done working?
Yeah.
Dude, I like the Martin.
Oh, you play guitar?
Yeah, I played since I was like 10 years old.
Oh, no.
Yeah, when I lived in Michigan back in the day, I had a band and we did the whole touring thing. And
So,
past life, I was a singer-songwriter. I've released a couple albums and
Really?
Really?
What was the name of the band?
The New Green.
The New Green.
Yeah, we played quite a bit around here.
What kind of venues? Where'd you play at?
Mostly Ann Arbor, so like the Blind Pig a lot and the Arc.
Yeah.
Out here, we used to play in Detroit at
You guys played the Ark? That's impressive.
a lot. Yeah, I used to play there a lot. We were like orchestrated folk pop is what they would call us. It was like pop music with lots of strings and horns. And
Okay. So you went to Michigan?
no, I went to a whole different U of M. I went to the University of Montana.
Oh, really?
But I grew up in Ann Arbor.
Okay.
So I was born and raised in Michigan.
Cool.
Turn this thing off.
Okay, so a couple things. So trying to set anything on the table, 'cause it's super loud.
Yep.
And it picks up everything. And this is a bidirectional mic, so when we talk, we just want to try and stay as close as you can to the mic without like being uncomfortable, and try and keep it like relatively, similar.
Okay.
And that's basically it. So
Anything I should know
even
about?
like that,
Yeah.
like it's so loud, it transmits.
Really?
Anything I should know about sort of format, length, like how long does it? Is it?
No format, no length.
Okay.
All I need is that you guys are entertaining, insightful the entire time.
It's a tall order. I don't know.
Don't worry about me. I'm gonna edit myself to sound like a genius either way. So, so how did you guys? So introduce. How about you introduce yourselves first of all?
Okay.
Okay. Let me know when you record. Are you recording now?
Yeah.
Okay.
I'm gonna play with the levels as we talk, but
All right, so I'm Steven Clausnitzer. I'm the CEO of Forever Labs. We are a stem cell banking company. So essentially, we will store your stem cells so that you can live healthier longer.
all right.
And I am Tom Nabity. I am a good friend of Mark Pankinen. We go back to medical school. I am a interventional pain physician and a physical medicine rehab specialist. I started utilizing adult stem cells for regenerative medicine purposes, orthopedic purposes, shoulders, hips, knees, backs, spines, about 2 years ago. And was introduced to Steven probably 6 months to a year ago.
Yeah.
And really liked the concept of what their company was doing and where they were basically investing in the future of stem cell therapy for disease states that we just don't have answers for yet. But the whole idea is I'm getting people's and utilizing people's stem cells today for an orthopedic purpose. Why don't I throw some in the freezer for tomorrow for whatever purpose might be coming up?
Okay, so your company specifically just on the storing end of the stem cells.
Well, on the forefront, yes, but we're also doing a number of we're doing work on the back end to propagate the science as well. So, for example, right now with Henry Ford, we've got an experiment going where we're taking mesenchymal stem cells from young mice and we're reintroducing it into older genetically matched mice. We have one group that's getting one reintroduction of these MSCs, mesenchymal stem cells, and another group that's getting several reintroductions, and of course a control group. And we have a group that's getting older MSCs reintroduced. And what we aim to show, and we're confident we will, is that by having younger stem cells reintroduced to these older animals, we can revitalize them. So sort of a health maintenance approach.
Right. So that's super interesting. I want to come back to that.
Sure.
Maybe you want to say just a little bit about what stem cells are, just like basic definitions, people listen.
Yeah. Basically, a stem cell, and Doc, you could probably do an even better job than me on this, but a stem cell is a cell that has the ability to become many other cell types in the body. And the ones that we store are bone marrow-derived stem cells, and in there you have mesenchymal stem cells, which can become any part of the mesenchyme, bone, connective tissue, supports your immune system. And also in there you have hematopoietic stem cells, which can become blood, your blood-building stem cells. So a stem cell, again, is a cell that can become many other cell types within the body. So
you want to maybe say what the difference is between embryonic stem cells, which freak some people out, and mesenchymal stem cells?
Yeah, well, so the reason embryonic stem cells freak people out is because they're coming from embryos, right? What we're doing has nothing to do with that. We're storing your own stem cells. So Mark, how old are you?
41.
All right, so you're 41 years old. So your 41-year-old stem cells, what you may not realize is that perhaps the greatest asset that you have right now is your 41-year-old biology. And you might say, oh, it doesn't feel that great to me right now, but the reality is when you're 51, 61, 71 years old.
Worse.
Exactly.
So you're saying it's going to suck to get older?
Yeah, surprise, surprise, right? But the thing is we can take your 41-year-old cells and we can freeze them and render them biologically inert.
Which I'm doing, by the way. I don't know if Tom told you.
No, that's awesome.
I signed up, so yeah, we'll
awesome. We're high-fiving over the mic.
Well,
yeah, so we'll talk specifically about what Tom's doing for me.
Okay. Yeah, so the thing is, a lot of people don't realize this, but as you age, you have less of these cells, and the ones that you have become less therapeutically efficacious. So there are over 500 clinical trials that are using the cells that we store to treat age-related diseases like osteoarthritis, which I know, Tom, you're very familiar with, but also cardiovascular disease, stroke, and these are the number 3 killers of our species, right? And these are in phase 3, so it means they're coming out of trial soon into mass adoption. But what they're finding is that when you need them the most, because you're not going to have a heart attack likely until you're older, right? When you need them the most, they're going to be at their worst. So the idea is like store your cells now, your 41-year-old cells now, so that when you're 61, 71 years old, you can use them for these to treat these age-related diseases. So that's sort of like the most pragmatic purpose for doing it. But there's this like incredible moonshot, we call it, purpose for storing them as well, which is what if you could take your 41-year-old cells and when you're, let's say, 48 years old, you start reintroducing them, not to treat anything specifically, but just intravenously reintroducing them, because you can grow these to a great number of these cells. Start reintroducing them to reconstitute your bone, blood, and immune system, thereby having 41-year-old biology sort of in perpetuity. So health maintenance as opposed to disease treatment, that's why we started the company. And when you asked, we're just a banking company, we're not. We're actually doing a number of things behind the scenes to bring that to market. So we want to bring forth the first ever clinical trial in the U.S., FDA-approved clinical trial, where we're taking the cells that you stored with us and reintroducing them for health maintenance purposes. Does that make sense?
Yep. So it seems like there are 2 wings of this. There's as far as where the science is so far.
Okay.
So most science, it seems like, have to do with Tom stuff, like local injections. And then there's been a lot of work on specific disease states, like you mentioned, cardiovascular disease, I know is huge, stroke, brain injury, they've done a lot of studies. Mm-hmm. The stuff that's kind of brand new is what you're talking about, the health maintenance, anti-aging, preventative medicine based on stem cells.
Yep.
So maybe before, Tom, you talk about the joint stuff a little bit, when you say the cells when you're younger are better than when you're older, mm-hmm. I'm guessing there's a mix of healthy and unhealthy cells in every aspirate of the bone marrow or the fat, wherever you take it. Is there any ability to sort out the young stem cells versus the older stem cells and enrich the population for the good ones, even if you're older, maybe?
That's a really good question. So, these cells exist on a spectrum, right? There are people that are doing some really fantastic work around selecting for senescent cells, so even in vivo. So these are cells that have turned off. basically what a cell will do, and again, you probably know more about this than I do, but what a cell will do is that at a certain point, it sort of commits suicide. It turns itself off. And we believe, scientists believe that this happens for a very good reason. If a cell gets too old and too damaged, it can start replicating out of control, and this is where cancers come into play. So a cell will go senescent. It will turn itself off. But it's still in your body, and these senescent cells can have really negative signalings to the tissues around them, and they're sort of bad news, bad mojo for the body. And there are groups that have figured out how to identify these senescent cells in the body and remove them. What we're really interested in doing is that sort of work ex vivo. So can we remove the senescent cells from the ones that we've taken out of you, and obviously just be replacing into your body the younger, healthier cells? So to answer your question, yes, there are ways to select for the better cells. Now, there are also people that are working on, and we're one of these people, on how to de-age a cell itself. So what if you could take your 41-year-old cells and apply technologies to them, ex vivo, out of the body, that will have them express like they're 31, 21 years old, and then give those back. So that, to me, is what's really exciting. So I'm 40 years old now, so we're essentially the same age.
When did you store yours?
I was going to say, my stem cells are 38 years old.
Nice.
So they're 2 years younger than me, and that feels really cool. But what if I could take those 38-year-old cells and get them to start expressing like they're 18? And that's, I think, the future. Is reintroducing those. And at Forever Labs, we're working in conjunction with already existing technology to develop therapeutic IP around just that.
Okay.
Yeah.
So I think one thing you haven't mentioned yet that was really cool about when we met, your story, was how you guys and when you guys decided to start your company. Because you were doing research that wasn't around adult stem cells.
Yep.
You were doing research that was around a different type of stem cell. And then basically said, boy, I wish I had my stem cell stored, so why don't we create this company?
Yeah,
Can you share that story too?
I would be happy
maybe
to.
before you get into that, just say what your research background is.
So I should also mention, I'm the CEO of the company. My entire background is in business development and leading teams, okay? So I am literally the only person on the team that doesn't have a PhD or an MD associated with my name.
Gotcha.
But I've been working with these guys for long enough to where I'm pretty dangerous when it comes to talking about this stuff. Let me tell you, but that's a good point, Tom. I think it's worth mentioning the origin story. I've been working on a project with Dr. Mark Katakowski, my co-founder. He has a PhD in medical physics. He's been working with these cells for like 17 years now. And we were working on a previous project together. We're on the phone talking about that project, and Mark started telling me all about how about 5 years ago, Mark was applying to the NIH and the NIA for a grant to take cells from young mice, put them in older genetically matched mice, and he didn't get the grant. But he had recently found out when we were on the phone that several groups had done similar work. And they had shown that these mice lived it was about 16-20% longer than the control group, which is pretty substantial. And Mark wasn't upset that someone else got credit for an idea he had. He wasn't upset that he didn't get the grants. He was upset because he had just turned 40 years old, and he was trying to find a company that would store his stem cells for him because he knew how important they were and how quickly they would diminish thereafter. And he couldn't find one. And he's telling me all about this, and I'm like, well, I want to store my stem cells.
Right.
So we always say that Forever Labs was actually born out of our own midlife crisis. We wanted to store our stem cells. But that's how it happened. It was out of our own desire to store our cells and our families. So, yeah.
All right. Tommy, maybe you could talk about what you're going to do to my shoulder and some of the ortho applications of stem cells, since that seems to be the least controversial area in stem cells right now.
I think there's other applications as well. Stem cells have been used in the dental industry for a long time, in plastics for quite a while. They've just recently being in the past 8 years, entered into the orthopedic space. And essentially, the idea and the movement is moving from more invasive surgeries to least invasive surgeries. So when I first started getting into utilizing these cells, I went to a conference, and probably one of the more influential lectures I heard was from a retired orthopedic surgeon who in the 70s was one of the first orthopods to use arthroscopic techniques. Prior to the scope, having your knee scoped or your shoulder scoped, everything was done open, so it was a large incision, and everybody was trained with open technique. So when this new technology, this arthroscopic technology came along, he was one of the first adapters. He got a lot of resistance. He got thrown out of the American Academy of Orthopedic Surgeons. He lost his hospital privileges. His colleagues told him he was using the tool of the devil, and there's no way you can see what I can see with an open procedure through a scope. But he knew what he was looking at. He knew the outcomes he was getting. He had professional athletes come in to see him to pay cash. Insurances weren't covering it yet because they wanted less invasive, quicker recovery times, get on the field quicker. Mm-hmm. Well, time and history is clearly on his side. He got the Lifetime Achievement Award from the American Academy of Orthopedic Surgeons. He obviously got all his hospital privileges back. He had a very illustrious career. But he just knew what he was seeing. He was just one of the first to know what he was seeing. Mm-hmm. So my jump into this was basically him telling me, hey, this is deja vu all over again, you guys. I'm on your the academy training that I went to was the American Academy of Orthopedic Medicine. He's on the board. He's working on coalescing data, collecting data, putting treatment protocols together so we can prove to insurance companies, we can prove to the world that if you do it right, if you get the right cells and use the right technique, you're going to get the right outcome. Mm-hmm. And it's the next step in less invasive surgery. So it's really used for anything you would think of going to an orthopod for to get scoped or replaced. Elective orthopedic surgeries. It doesn't replace trauma. There's always going to be a place for joint replacement and spinal fusion surgeries and the like. I don't see regenerative medicine completely taking over all treatments, but it definitely is going to offer patients a less invasive option for their elective orthopedic problem.
And whenever you're on the innovative boundary of anything, you're going to be ahead of the science. The steam engine came before the science of thermodynamics. Mm-hmm. There's always going to be this realm where you're kind of waiting for the science to catch up. And if you just waited until there was a massive, double-blind, placebo-controlled, multi-center trial for everything, it's going to take a long time. And part of the drive to get those studies done are kind of the things on the fringes, the case studies, the anecdotal reports, and so yeah, I think it's a fascinating field.
It is. It's fascinating. It's a little scary in that you want to always be offering your patients the best thing. What's the best way to treat your labral tear? I don't know yet, but I do know that what I'm going to offer you.
I thought it was what you're doing.
What I do know is what I'm going to offer you is going to be better than your surgical option.
Yeah.
So while what I would do for you tomorrow might be different 3 years from now because we're going to learn different techniques and different protocols. So when I go to these conferences and they have these expert panels and you talk to them about how they treat shoulder labral tears, and one guy does it this way and the other guy does it this way and the other guy does it this way. How are your outcomes? Great. How are your outcomes? Awesome. How are your outcomes? Really good. We have to get large data to say, hey, if you take this guy's part of his technique and add it to this guy's part of his technique, you're even going to get a better outcome.
Yeah.
We're just not there yet. But the good news is that they're all getting good outcomes.
Part of the problem, though, nobody wants to show up at the conference and be the guy that, hey, none of my stuff works. So it's like everybody has that bias.
Yeah, I feel like it's funny. At Forever Labs, we're in a really safe position, right? In the sense that it's just factually true that as you age, you have less of these cells, and the ones that you have get crummier, right? I mean, that's just a fact. So,
and the risk is totally dependent on the intervention. So storing your cells is a very low intervention, very low risk.
Super low risk, super high reward, right?
And the injecting my shoulder, you're using my own cells, which is autologous, right? My own cells. The risk of rejection, risk of side effects, it's very, very low. So I'm kind of in the camp where my shoulder's not serious enough to go to surgery. So I'm going to give it a shot, but I have I have an open mind. I'm not expecting any miracles, and if it doesn't work, I wouldn't be that shocked. I understand it's kind of on that a little bit of uncertainty there, but it's a process, and it's going to continue to improve. So along those lines of all the different factors of the protocol that it takes, and all the different places where you could either become more or less efficient. One would be where you get the stem cells, right? So you can get them from cord blood, fat, bone marrow, And so that's one variable, right?
Dental pulp is a new one that people are really interested in.
So is that, at least that part of it, how much evidence is there that there is a best place to get the stem cells? Do we know that part yet?
We obviously have come down on the side of bone marrow, and I can tell you why. I can tell you if there's a best part or not. I can tell you our thinking around it. I think I referenced earlier there are over 500 clinical trials using the cells. The vast majority of those trials are using bone marrow-derived stem cells. Also, a lot of these treatments focus on the MSCs, rightly so, the mesenchymal stem cells. We're after the entire bone marrow niche. So what we want is, Mark, 10 years from now, if you need these cells and there's a treatment using HSCs, the blood-building stem cells, hematopoietic stem cells, and we stored your fat, you'd be really bummed out because there are really no HSCs in there. The same thing with the dental pulp. So the bone marrow, we're after the entire niche. We want to store the bone marrow so you have access to the MSCs, the HSCs, endothelial progenitor cells, the various stromal cells that are in there. We're essentially trying to save game state your young biology by freezing your entire bone marrow niche.
Let me ask you this. So one of the earliest and most successful stem cell treatments is bone marrow transplant.
Oh, yeah,
it's been
of
around
course.
for 20 years, right?
Yeah.
It's very, very successful.
Uh-huh.
Theoretically, if I develop some type of hematopoietic cancer, I need a bone marrow transplant. Would you have enough stem cells or be able to enrich the stem cells that I donate now, say 30 years from now when I need a bone marrow transplant? Or would it still be less optimal than the way they currently do it with somebody else's bone marrow?
No, I mean, I think without a doubt you would look to what you have stored with us to help you. Now the question is, have we stored enough of the HSCs? We find ourselves right at the cusp of that. So when we measure how many HSCs we're storing and whether or not there'd be enough and viable to actually engraft and grow, we're kind of right on the cusp of that. But what we're actually looking at right now, it's kind of a timely question, is there are groups out there that are growing and culturing HSCs. So we have enough to utilize that technology. We're trying to find a good partner right now so we can show verifiably that we have enough, for that. We do believe that probably one of the first uses of the cells that one of our clients has stored with us will be someone that has a blood cancer, right? And in that case, we're confident that whether it's through just having enough that you stored with us to engraft or us growing HSCs, you will be very glad that you have that resource.
The growing HSCs or the colony expansion, blood cancers is one of the indications that FDA will allow you to culture expand and then re-inject, correct?
Yes.
I think this might be a good segue to talk about a little bit of the restrictions FDA has right now on what's called minimal manipulation to these cells. They have these laws that state that we cannot go beyond a certain threshold of manipulating these cells and re-injecting them or reintroducing them into the back into the body within the United States. So blood cancers is one of those indications that you can culture expand or address the cells. But I guess a little bit on the options that we might have going forward.
Sure.
With,
nice transition, man. You're a good co-host. You want a beer?
Yeah, I will.
I will actually take you up on that too now. I think it's time.
Oh, sorry. Now it's time. 15 minutes ago.
Yours just looks really good.
You guys want the Lagunitas?
Yeah, that'd be great.
All right. Sorry to interrupt. Go ahead and.
Well, I'll wait till the sound is.
Right. That's okay.
You sure?
Yeah.
All right. So that is a good transition. Currently in the United States, like you said, the FDA will not allow us to grow these cells and reintroduce them outside of an FDA-approved clinical trial. So, I mentioned there is over 500 of these trials. The majority of them are expanding and reintroducing. So if you're part of an FDA trial, it's fine. I believe that a number of these phase 3 trials are within a matter of a couple of years of hitting mainstream adoption. Thank you. So the current options right now, like you said, a blood cancer, that you could use your own cells, expand them, and reintroduce them to treat yourself. The FDA is extremely hesitant to get between a physician and an outcome, right? So, Tom, if you had someone that had a heart attack and you could grow their cells and reintroduce it and save their life, something, and you did it, chances are you would not have any sort of backlash. But if you're out there advertising, hey, come to Tom's stem cell expansion clinic, that's where the FDA has a lot of problems. But if they're very hesitant, this is my understanding, they're very hesitant to get between a patient and their physician. Yeah. Now, I would like to make a point that I think is worth making. There is no shortage of people out there offering stem cell treatments for what I believe are nefarious intentions, right?
Correct.
They're just trying to make some money. The one thing I would recommend anyone out there that is going to have a stem cell treatment or is going to do anything with stem cells is first, take a look at the physician. Is this a physician in good standing, and are they practicing medicine in their chosen specialty? I think that's a very, very strong indication of whether or not you have someone who's on the up and up. I'm sure you would agree.
I couldn't agree more. I think we as a physician community are going to be potentially our own worst enemies in destroying what could be the next greatest thing for healthcare. I mean, eventually the science will catch up, but we could delay it 10 or 15 years if we allow nefarious, charlatans practicing, just
kind of lean in a little bit.
Whatever, kind of stem cell treatments they want to call a stem cell.
Yeah, a lot of them aren't even stem cell treatments. So
they're doing whole blood injections.
Yes,
they're doing
exactly. Yeah,
cell.
I was doing a lot of research for this, trying to figure out what's being done out there. And so I just Googled stem cell treatment and came up with a couple of links of companies that do this. Right. So example of, I wrote it down here because it's funny. They say therapeutic levels of stem cells have proven to help enhance your mood, energy levels, sexual health, cardiovascular system, immune system, and memory, right? And then they have a link to the science. And when you click on that link, which I guess they just assume nobody's going to click on the link. Because when you click on the link, they cite a study, like some cell culture study, looking at the mesenchymal-derived cells from fat versus bone marrow and how they perform with their cell surface markers. A total in vitro study. It has nothing to do with any of the claims that they make, So there's a whole lot of people that are enticed by, it's partly why it's a good business model, because everybody wants to stay young, nobody wants to die. And so it's basically a promising possible treatment for a lot of this stuff. But that same draw can really make people susceptible to all these charlatans out there.
Yeah. We had a lot of choices to make as a company when we started. Like bone marrow or fat was the first. And I gotta be honest, like fat's really enticing, and I'll tell you why. From a marketing standpoint, when you say to someone, hey, I can take some of your fat, they raise their hands like, hey, I'm next, right? When you say I'm going to take your bone marrow, people don't get really excited about that. But the reality is,
I'm not excited about it. Everybody I talk to says it's really fucking painful.
It's not.
Except me.
Except
me.
You're the one.
Yeah, Tom had it done.
You had yours done.
I had mine done.
It's not that painful.
We've had hundreds of people have it done.
Off of me. The only ones that tell me it's not painful.
Listen, I will give it to you straight, right? I go to as many of these procedures as I can to meet our clients, and I ask the same question of all of them. I ask them to rate it on a scale of 1 to 10, with 1 being no discomfort at all and 10 like highly painful. And we're averaging a 2 or a 3 on that scale. Some people have said as high as a 6, but even that, the 6 it lasts for 10 to 20 seconds.
Yeah, I'm not that worried about it.
It's really not bad.
With the bone marrow aspiration, how much of a range is there for the yield of the cells, right? Both, it's going to depend on, I guess, technique and also the donor. And I would think that the amount of cells that you're reintroducing is a big part of the success or lack thereof. So how much range is there, and do you need to go in and quantify and look for the quality of the aspiration before you go forward with the injection?
Yeah. So as far as what you're having in your shoulder done, that's a better question for Tom, but the what I would tell you is there's a lot of indications to show that it's not even just the stem cells, but the soluble factors that are given off that are, going to be helping your shoulder. The other thing is, as far as what we're storing at Forever Labs, you're right. Like the older you are, you're going to have less of a yield of the actual cells, but anyone that's going to be using these cells in the future is thinking about expansion, right? You're not going to just be taking the actual bone marrow mononuclear stored that we have and just reintroducing it. You're going to be growing these cells. You'd be foolish not to. So if you're 51 years old, you don't want to just use it one time and be done. You're going to grow.
But that first instance, it's a one-time deal. You show up to the clinic, get the bone marrow aspiration, get the injection.
Yeah.
You're saying in the future.
Yeah. So I'm saying that, and by the way, there's plenty of evidence showing that you're gonna. And I think we should probably do another one of these 6 months later, right? Like talk about. I think that'd be cool. Like talk
how my
about
shoulder's doing?
Yeah, how's your shoulder doing?
How the lawsuit's going?
No, I'm confident that it'd be you'd have a lot of positive things to report. But so you've got hundreds of thousands of cells in there. The idea is like for us on our end of it, which is the end I'm comfortable speaking towards, we're going to have more than enough.
Is there a minimum? Like, you need one, and then you could culture expand?
That's a good question. I don't know the answer to that. I know what I can tell you is like there's a maximum that you can expand. Like eventually they get to this thing called the Hayflick limit, where it's kind of like making back in the day. Remember when we had VHS tapes and you would make a copy of a tape, and eventually the tracking got all off and it got bad. It's kind of the same thing with cells, right? Like you start expanding and growing these and replicating them enough. Eventually you reach a limit where they're starting to degrade.
So we'll have to figure out at some point, when do you need to reharvest? So it makes sense to maybe do a second harvest and have a second group. So have your 41-year-old cells in the freezer too.
What you store with us, you have an almost unlimited amount. I mean, you really do. So the way we store it, and you'll see after you store with Forever Labs, you'll be able to go to like a dashboard and see a picture of your stem cells there. And we store them in these aliquots. We have 3 large aliquots of your cells, and then we have, and they're about the size of like a standard, index finger. And then you have 7 what we call micro aliquots of your cells, which are about the size of like the tips of a shoelace, the end of a shoelace.
And do you spread those on different freezers in case one goes down?
That's a good question. I'll get to that in a second. So we have, from one of those just micro aliquots, my partner, Dr. Katakowski, has expanded and grown more of his stem cells outside of his body now than he has in his body, by far. So this is to say that you really do have an almost unlimited amount. So by the time, Tom, to your point of like, do we need to reharvest again? By the time you have actually extinguished the amount you have stored with Forever Labs, there's likely to be technologies on the market that make what we have stored moot. So I'm talking like 50 years from now, As to your question, Mark, about can we store them at different spots? Currently, we do not, but you're not the first person to mention it.
Do I get my money back if the power or something?
I would do that. Yes, I would give you your money back. We store them on the East Coast with Fisher Bioservices.
In a mile underground bunker.
No,
it's going to survive anything.
They're above ground, but they're stored in liquid nitrogen. So if the power went out, they'd still be fine. We don't store them on the West Coast for a reason. It's too seismic. So we had to make a decision, where are we going to store these things? But there have been customers of ours that have asked to have them stored at multiple locations. Sense. It does. It's sort of mitigating any sort of catastrophe.
My question, though, maybe that's not an answer, is what is the yield, the difference in yield, if you take, say, 140-year-old healthy males and you do bone marrow aspirations, what is the yield range of stem cells that you get with those aspirations? And is it worth quantifying that to see if you reach some critical level where you have enough to do the injection?
So that I can speak to. That is a question that like the AAOM is looking at, is what are the minimum colony formulating units, CFUs, is what you talk about when you're talking about volume of stem cells. What are the minimum CFUs, and is there a point at which you're injecting too many CFUs? So we found with platelet-rich plasma, for example, there is a minimum threshold that you really need to get above in order to get a good outcome. But there's also a maximum that you don't want to go above. So you want to play somewhere within that range. That answer hasn't been quantified for stem cells yet.
So the ideal number isn't known, but what about the range within each individual aspiration? Is it pretty much, take a healthy person at the same age, you're going to have a pretty narrow range?
Yes.
Or is it all over the place?
No, it's a pretty narrow range, and especially if taken from the same source. They have looked at different sources in the body, meaning do you go to the posterior superior iliac spine? That's the most common source. versus the tibial plateau just below the knee, versus if you're doing a shoulder, just going into the bone marrow at the humeral head. So like somebody's doing a scope, they're going to grab some stem cells and add it to whatever they're doing arthroscopically. A lot of orthopedic surgeons, or some orthopedic surgeons, are looking at that. Those studies are in the mix. One of the things that I want to probably start doing with my patients is utilizing Neupogen, or colony stimulating factor, to stimulate the bone marrow a couple days before I'm going to do a bone marrow aspiration. I've looked at a couple studies just showing how much it improves the CFUs, or the yield from your bone marrow aspiration. And my thought is more is better. I just can't imagine that there's going to be a study that says you can inject too many MSCs.
Yeah, so check this out. They actually just did release a study where I think it's like, University of Miami. They're doing research somewhere. I'm sorry, I can find the source later.
You're talking
about frailty. Did you look at that?
Yeah.
It's pretty cool stuff. So they actually used allogeneic cells.
Which means?
Donor. Yeah, I'm sorry. These are cells that are donated from someone else. And they were taking young cells, and this is in humans, young cells, and introducing them, I think, into like 70-year-olds.
Wasn't it serum, not cells, for that study?
Pretty sure it was cells. We can take a look at it. I was just told about it by one of our doctors the other day. Was talking to me about it. So this is coming, like, I haven't actually read the study. I'm quoting the physician that I was talking to.
Was this the gerontology study?
They looked at frailty. They looked at like how distance that someone could walk, and also respiratory measures.
But it wasn't blind, and it was still early. And this was basically a safety trial to do the phase 3 study.
Yeah, what we thought was really cool, and let me know if you agree from it, was that they basically, sort of to Tom's point about CFUs, they took a look at if you introduced, it was like 2 million cells and less, like between 1 and 2 million, or they introduced 1 million cells is what it was, and it was efficacious, right? They had positive results. 2 million cells, and it was not efficacious, and they saw some immune rejection. So we believe strongly that if you were to have these be autologous cells, right? So like your younger cells to your 70-year-old self, you could have 2 million reintroduced, and you get no rejection, obviously. You get no negative immune response. The cells stick around longer. They're able to have a way greater benefit than these allogenic cells. So that, to us, there's two things. Very positive. Like, we're excited about this study, but we're more excited about it for autologous applications.
Right. If you see a benefit with this situation,
imagine.
Yeah. Do you? I'm going to tell the story for people listening. But have you heard of the story of the parabiosis experiments they did in the 50s?
Yeah.
Where they started coming up with this idea. So they took
the 2 mice.
Yeah. They took an old mouse and they took a young mouse, and they surgically connected their circulatory system, their vascular supply, right? And then they let them live together for like 18 months. And so
pretty grisly stuff.
Yeah, and they were sharing the same blood supply, and they started seeing all of these rejuvenating properties in the old mouse, and they started seeing all these premature aging in the young mouse.
Yeah.
And so they started this whole path down looking into this. Like, there's something in the blood, we don't know what it is. There's also something called parabiosis syndrome. And something like 20% of the mice just rapidly declined and died, and they don't know why that happened either. So there was some kind of pushback, like, well, we're playing with something we don't fully understand here, and so it kind of got shelved, and nobody really worked on it until recently in Stanford. Somebody started doing it again, and what they did is they took the young serum from young patients, and they treated these frail patients, and now they've got an Alzheimer's study that's, as far as I know, it's done. They're just waiting for the studies to come out. Ambrosia is the name of the company?
Yeah, so the trial, I believe, is called the Ambrosia trial. Yes, and it's the name of the company. And I believe it was born out of this work at Stanford.
And there's another guy, I think he might be in Vegas. He's like some 32-year-old entrepreneur, and he's charging like $8,000 for anybody to come in and get infused with serum from young patients.
Maybe that's the Ambrosia trial. I'm not as familiar. I should be more familiar with it. But I mean, the thing is like it's all this stuff is backed by really long, like you said, that mouse trial is like decades ago, or the circulatory system being sewn together. So there's some solid science behind this stuff, and it's been known for a long time that there can be positive effects. And it's funny. Do you guys ever watch that show Silicon Valley? Mm-hmm. They had the Blood Boy episode, which was all about like the
Peter Thiel.
It wasn't Peter Thiel, but like perhaps.
Guys, yeah.
But nonetheless, after that episode, I got a number of phone calls from people saying, "Hey, is this
you want
for
to
real?"
Tell what the Blood Boy thing is?
Yeah. So basically, it was an episode where sort of the bad venture big guy, like I think his name's Gavin Belson in the show. He's got a young guy sitting next to him with giving his blood directly from him. So he's basically I think you're right. Peter Thiel caught a lot of.
It's a comedic take on what people are actually doing though. So Peter Thiel is some billionaire Silicon Valley.
He was one of the co-founders of PayPal.
Yeah, and he's getting infusions of serum from young, healthy, like 18-year-olds.
That's not a fact, but I mean.
I thought he was fully open with that.
No. So I know that they were looking into and investing in one of those companies, and then the media just went crazy with like. Silicon Valley vampire Peter Thiel. So I'm not sure that that's a fact. But what I can tell you is that there's a lot of science behind it, right? And what we're excited about at Forever Labs is we're storing your bone marrow. Your bone marrow is the largest producer of blood in your body. So you are essentially storing your own young blood factory, by storing your bone marrow.
I'm totally... So I'm skeptical by nature, and I have no problem trying this joint injection. I have no problem storing my stem cells. Mm-hmm. But some of this stuff with the systemic stem cell therapy just seems to me way too good and easy to be true. You just take your stem cells, just put it in an IV and infuse it, and then you're going to get smarter, younger, healthier. I mean, it seems to me to be...
I don't know about smarter.
Yeah, that's probably hopeless. But
to your point, what if it is true?
Yeah,
do you want to wait the 30 years for the long-term safety and efficacy studies to come out?
Is, we know that there are factually things that work, right? Like we know, for example, I don't think I've referenced this yet. So at Johns Hopkins, they just released not too long ago findings from a study they did where they took people after a heart attack, grew their own bone marrow-derived MSCs, and introduced them into the infarct area of the heart. So where they had scarring and damage, they're able to regrow healthy tissue. It's miraculous stuff, like never before stuff. It's amazing. But there's a number of people that wanted to participate in that trial and couldn't because when they plated their cells, number one, they didn't have enough cells, and number two, the ones that were there wouldn't grow. And it's because they were too old. So there's some really, we know there are some pragmatic reasons for banking your young stem cells.
Yeah, that makes total sense.
Now, is it going to make you smarter? Hey, that's the stuff we're working on, right? That's the moonshot. The moonshot that it can keep you healthier longer. We're working on that. I'm excited about that. But let's say that doesn't work, and the worst case scenario is you get to treat your stroke and have a full recovery when you're older. Awesome.
Worst case scenario, you try it. You start doing stuff preventative now. I can't see how these things can be dangerous. I just can't see. It's your own cells.
Yeah, they're not going to be dangerous.
I mean, if you can infuse it in a way that it doesn't create like an immediate PE or some sort of a clotting event, that's my biggest worry.
So that, for example, is one theoretical risk.
Correct. So you look into how people blood dope. Cyclers have been doping their own blood for decades. So you watch and you learn from the people who are cheating the cycling system. Because have you ever heard of a cycler dying from a PE? No. So they've done it safely.
Didn't a couple cyclists die with strokes from EPO and?
EPO is different than just the IV blood doping. But okay. Yes, yep.
Yeah, I mean, you'd be introducing a relatively small.
So the studies they're doing exactly. They're talking about 20 mLs, not with high volume that the cyclers were doing, where they were overloading their ventricular system with too much fluid or volume in their fluid. So you look at you learn from the ways that people have been doing this before. But I just have a tough time telling my parents, who are in their mid-60s. Sorry, you guys are going to miss the boat on this one.
But you still technically have to say, we don't know for sure you're not going to have a PE, like you said, right? Because just the amount of systemic stem cell infusions that have been done are so small that you can say, well, it seems safe, there hasn't been any complications, but when you're looking at an N of such a small number, you really don't know.
Well, I mean, there's a reason FDA-approved clinical trials exist, right? So I'm not like one of those guys that poo-poos the FDA. I think like we need to do the work. We need to show like in animal models first. I'm talking about regenerative medicine here and like the health maintenance aspect. And we're doing this work. Like it's already underway at Forever Labs. So we need to show that it's safe and effective.
It's good businessman. You mentioned Forever Labs a few times.
Sorry, it's like second nature now. But we need to show it's safe and effective in animal models. Then we need to have a trial with an approved IRB and do all this good stuff and show that it's safe. And then go from there. It's going to be, though. Yeah. I mean, I'm telling you, it's going to be. So that's my least of my concerns. Yeah. Is like
it comes down to a personal decision because there are going to be people that are willing to roll the dice, and even if it's not FDA approved, like I'm going to give it a shot. And that's fine as long as they're well informed of the possible outcomes and the uncertainties.
Yep. So the one thing I always want to make sure I get across when I'm talking to people about this stuff is two things, and I think I have, which is. There is the practical reason for doing it. That exists. So if you're just a pragmatic person and you're not a super, You're not one of these first adopters kind of people that just wants to go out and try everything. This still makes a lot of sense. Like making your stem cells is actually maybe the most pragmatic thing you could ever do health-wise.
Yeah.
But if you're also one of those people that are just super excited about technology in the future, I mean, and I'm one of those guys, this makes a lot of sense too. Like the upside is, I mean, just potentially, even if it's a small potential, I think it's a large potential, but if it's small, enormous. I mean, like the ability, out in Silicon Valley, our largest market by far is San Francisco. I mean, by far. We have the most people banking their stem cells out there anywhere. So they're doing it out there, and they're talking about things like escape velocity, right? Like the ability to get to a point where you can live long enough to where you're aging slower than technology is advancing, you know?
So you can make it to the singularity?
Exactly, yeah. So that's what, like, and then in Michigan and North Carolina and Texas and New York, these other markets, it's more pragmatic, you know, and these are all places where we do offer, the procedure.
What about
the Midwest?
Since you're storing stuff anyway, what about my boys? What about sperm? Just add that in there for a fee.
There's no shortage of people doing
it. There's some.
Yeah, let us solve aging. You can other people solve that for you. But yeah, I do imagine that we'll get to a point where at Forever Labs, and we already have this, like a dashboard, where...
what do you mean dashboard? What do I see?
You log in and, you have your own specific dashboard that will have your stem cells there. You can request them at any time.
What would I be looking at on a dashboard of my stem cells?
So right now, you're just really looking at new research, things like that we have listed there. So you can go there at any time and, new posts from us, other places. So you can just keep abreast to like stem cell research. That's one thing there. What I want to have this thing be eventually are different offerings towards longevity as a pursuit that we can offer you through the dashboard, whether it's like measuring your telomeres and you're doing, things like that.
Yeah. There's a whole bunch of stuff that's on that realm. And I don't know if the company's getting into growth hormone, testosterone replacement as well. Is that something that you're doing in conjunction with Forever Labs, or is that something a separate thing
that's a separate entity that I'm pursuing as well. It's kind of along the same concepts of feeling better longer, feeling good longer, and then living longer.
Yeah. So I mean, we're at a time right now where the quantified self is a thing, right? Everyone wants to know as much information about themselves, from their genetic composition to their diet. This didn't exist in our parents' generation, right?
I did 23andMe. Have you guys?
Me too. Yeah.
Except I didn't look at half of it because I didn't want to know if I have risk for early onset Parkinson's because I can't do anything about it. So I was too chicken to look at that.
I don't.
Maybe not.
You looked? You checked on that?
Yeah, I looked. There are things I know about myself that perhaps I wouldn't want to know.
Yeah.
There really are.
So it just adds to your anxiety, but there's nothing you can do to alter the outcome.
There are things I can do, and I've done it.
Well, that's different. It's something you can address.
Yeah. I mean, I mean it.
Early onset Parkinson's. What about using IV stem cells to help prevent the onset of the early onset?
Well, same thing with Alzheimer's. So
that's the kind of stuff I don't want to wait for a 30-year study before I start. If I have that stuff, I'm going to take this risk. I'm going to take the risk of the PE. Because I know what the risk is of not doing anything. I want to start doing that knowing nothing. So all of a sudden,
I'm good on Parkinson's.
I of course think I'm perfect, right? So I have great genes from all my ancestors.
So you're convinced there's almost no downside to...
It passes all 3 of my tests. When I tell people about a treatment that may or may not work, it's got to pass 3 things. 1, I got to think it's safe. It can't do harm. Number 2, it's got to have some reasonable reason why it works.
Scientifically plausible explanation.
Correct. It's got to make intuitive sense to me why it'd be something that will work. And 3, it's got to be affordable. You're not mortgaging your house to do this.
Yeah.
And stem cells pass all 3 of those. It's not crazy expensive. There's definitely a reason to think that it works, and it's extremely safe. I'm trying to be critical like you are. I am not an early adopter. It took me forever to get an iPhone. I am by far probably the least. I still don't do social media. And I jumped on stem cells. I mean, when I got introduced to it, I was like, "What? This is crazy." Not.
I mean, it just makes sense on an intuitive level too, right? It's if it's a donor cell or something like that, I would be worried about it. But this is your own biology. I mean, so how does that not make sense?
These cells, when I tell patients what stem cells are, these guys are scavengers. They're like soldiers on patrol in your bloodstream.
Yeah. That's a good way to put it.
And then you have little soldiers. You have soldiers sitting in your bone marrow at the base, at the headquarters.
Yep.
So these guys, they're programmed to go out, find disease.
Yeah, they're like little doctors in the body.
Okay, let me try and push back a little bit. So any disease or any problem with your body physiologically also came from a stem cell. All of our cells ultimately came from stem cells.
Well, they didn't come from a stem cell. It came from the wear and tear of life.
Right. So you could have a healthy stem cell that produces a cell that then has mutation after the fact that turns into the problem.
Okay.
But you could also have stem cells that are the root of the problem. There's something genetically within these stem cells. So
that's where you get into this whole senescent cells that he was discussing earlier. Is isolate those guys, get them out of the play, take them off the field.
I mean, but you're right. So if you had, that's why you want to get them as young as possible too, right? So the older we get, the more likely they have more damage they've accrued. DNA replication errors, all of these things are more likely to happen as we get older and older and older. So I mean, grab them as young as you can.
It's such an unstoppable business model because that's one of the oldest tricks in sales. It's like, get it now. But offer in soon.
Yeah, but
call now. But this is actually true.
It's actually true. Yeah.
The sooner, it makes plausible sense. The sooner you do it, the better.
Yeah.
You are only as young as you are today.
Nobody can argue that aging is not a good thing for your cells.
I did this interview the other day, and they were asking at the end. They're like, "Is there one last thing you want to challenge the audience to do or whatever?" And I've never said this before, but I said it, and it is a bit salesy, I guess, but it's true, man. Like, my challenge to the audience was for the rest of the day, go out into the world, and when you see someone who's over the age of 75 years old, think to yourself, do you wish they had access to their own biology that was my age? And if you get a chance, talk to them. Be like, let's say they're 41 like you are. So talk to this 75-year-old and say, hey, if you could have access to your 45-year-old stem cells, would you take that right now? I mean, come on. It's just a no-brainer. And the problem is youth is wasted on the young. It really is. Most people, when they're younger, don't have the foresight to make this sort of decision. So, yeah.
Well, now there's the cord blood offering to anybody that has a baby, right?
Yeah, I just did it. My wife gave birth 5 weeks ago.
So, I did it with my kids.
Yeah.
Yep.
So when you do that, when the hospital gives you that offer, that's who's storing the cells in that situation? Are they affiliated with somebody like you, with your company?
Well, there's actually a ton of consolidation in that industry right now. So they're all kind of being gobbled up by the same parent group. I stored with Cord Blood Registry.
So are they a competitor of yours, technically?
I did via Cord. Yep.
Yeah.
So there's a bunch of companies that store cord blood.
Yep.
So how is that different than what you're doing?
Yeah, so it's actually quite similar. I actually refer to what we do as cord blood for adults.
Correct.
They're obviously very different in the sense that they're getting it at a different point from a different type of physician and a different source. All of these things. There's really one little window for them to have access to this. I feel like we're fortunate in that there is not that small window, for someone to do what we're doing.
What you should do is find out every childbirth within a certain area that didn't donate their cord blood and be like, hey, remember you had that chance to your cord blood, you didn't?
Yeah.
Well, good news.
That's everybody.
Good news.
There's
Still
such a small percentage of people that take advantage of the cord blood.
It is a small percentage. It's growing, but it's still small.
But think about it, too. I mean, it makes sense from a standpoint of when you tend to have children, when you have your first child, you don't have that extra income.
No.
I mean, you just really don't. Whereas when you start looking at your longevity, your health, most of the time you're starting to accumulate a little bit of disposable income. But, to that point, when we talk about the cost of this, I talk to patients and counsel patients, and then they're like, all right, well, how much is this going to cost? And I tell them the cost, and the response is really that's it.
Yeah.
I don't know if you mind that we talk a little bit about cost, because I think that's probably anybody that's listening is in the back of their mind. How much does this cost? You guys are charging $250 a year as a yearly storage fee, and then for the initial upfront harvesting, processing, and banking, if it's an add-on procedure, it's less than $2,000.
Yep.
Yeah, meaning if you're coming to me to treat your back, to treat like Mark, to treat his shoulder, well, I'm already grabbing stem cells to treat his shoulder. If I just grab a couple extra to send to these guys, it's less than $2,000 extra, and then $250 a year. That's to have access to your stem cells and have all the benefits for everything we talked about for the rest of your life. Whereas, let's say Mark came to me and just said, I really don't have any problems yet, but I want to bank my stem cells.
Yep.
Then it's about $2,500.
It is exactly $2,500.
Yeah, so it's $2,500, that's $250 a year. So the vast majority of people, think about the things that you spend that kind of money on that are just gone. They're wasted.
Yeah, that's what I mean.
Like, gone. Whereas you spend
youth is wasted on the young.
Forever.
Like, they're going to go out and buy a jet ski or something.
Right.
It's good for a few years and then it's done.
Or they buy a TV, or they go on a vacation.
Or think about how much money you spend on cable a year. It's just silly.
So this is a little outside of your field. I don't know if you know anything about the science of face injections of stem cells,
like microneedling and
microneedling.
Yeah.
You told me you can even inject it into your wiener.
Yeah, so it's outside of my field, but it's within my scope of practice because I've taken courses. Yeah. Yes. So
we have a physician that we work with in North Carolina that's doing those injections.
No, people
and
laugh about
he says they're working.
And it's funny. It sounds, it's like, really,
think about it. That's a huge quality of life improvement.
Well, think about, so the indication is erectile dysfunction. You think about the impact when Viagra hit the market that it had, and why it was so successful as a drug is because it's
it's revolutionary.
It's a huge problem. It's a medical problem affects a large number of people in the United States and the world. So the guy that we allowed us to train on him to get a free injection, it was his second injection. He was 70 years old. He was a Viagra or Cialis user for 5 years prior to his first injection, and didn't need it for a year and a half.
Where do you inject?
So there's 5 injections. 4 go into the shaft and 1 into the head. So it does sound awful.
What gauge needle? Not that it makes any difference.
So you use a topical anesthetic. You use a compounded local anesthetic. You let it sit on there for 10 to 20 minutes beforehand. The guy didn't jump.
Really?
He didn't move. He didn't grimace. He said, no, it really doesn't hurt that bad. And you go home and have sex that night, he said, and it's the best sex you've ever had.
Oh.
You feel it's the most intense sensation you have had. So he was all excited to go home and have sex that night.
Nice.
And then follow up, he had a teratoma growing out of him.
No. So you're injecting local. That isn't a stem cell injection.
So a teratoma, for people listening, it's like this freakish tumor where if you take, I guess pluripotent cells, like embryonic cell, that can differentiate into anything. So mesoderm, ectoderm, what am I missing? Mesoderm, ectoderm, endoderm. So you can get teeth, muscle, fat tissue. So you have these crazy complex tumors of every different cell type growing out of it. That's a terrible visual to have.
Terrible visual.
But that doesn't happen with autologous mesenchymal stem cells because they're limited in what they can do.
Yeah, they're sort of like already differentiated down in path.
That would bring us back from that tangent.
That's fine. Now, the other tangent I wanted to briefly talk about was, and I don't know if you know anything about this, but the growth hormone, testosterone, this whole push for looking at aging as more like a disease rather than accepting it as a normal part of life.
That's our entire company,
And this is another one of those technologies that is really on the fringe. And, people take these injections of having physiologically within normal-ish ranges of insulin-like growth factor and testosterone, but they take infusions of these things weekly, and they feel like it's rejuvenating. It helps bone density, muscle strength, density, cognition, all those kind of things. Do you guys have any thoughts on?
I definitely do. I don't know
go for it.
That's in your bailiwick or not, but so that's part of this company. Michigan Center for Regenerative Medicine that I'm founding.
Now you can plug your company.
There you go. So
what's the name of it again?
The Michigan Center for Regenerative Medicine. So we're basically
RCIM.
Yep.
MCRM.
MCRM. Yeah, close enough. So our whole and kind of to Steven's point, I've envisioned founding this company out of self-serving interests. I want to treat myself. I want to treat my family members. I want to treat the people I love with this. What I think is the next new thing and the best thing in medicine to really improve outcomes, prevent disease, and prolong productive life. We've done a pretty darn good job of prolonging life in managing disease, treating disease once it occurs. Once these major events occur, we're saving people's lives. We're doing a great job of that. As a rehab physician, once people's lives are saved, they get dumped on us to try to, make them, functional in society again. And it's amazing how bad we are at being able to really improve quality.
At that point, so you want to get them before the
and people's lives are extended, but their quality of life is really poor. And it's a lot of counseling. It's a lot of psychology that this is as good as it gets. This is accepting the new normal. Oh God, what can we do to prevent this? What more can we do? And that's really where the stem cells come in from a disease standpoint, and then the hormones come in from a functional standpoint. So if you really look at men in particular and our testosterone levels as they drop, to your point, is it safe to keep them from dropping? We used to be at 800. Normal range is between 240. Arbitrary normal range is between 240 and 1300. If we used to be at 800 and now I just have my testosterone level checked, it's 585. Is there a problem with me going back to 800? What's the downside? Those sorts of questions have been looked at. There are studies that are looking at how much risk are you adding by boosting your testosterone. There are studies that look at, is it really testosterone alone that increases prostate cancer risk? And it looks like it's not. It's actually the conversion of testosterone to estrogen that causes it. So if you prescribe testosterone with an estrogen blocker, you actually get a decrease in prostate cancer risk. So there's a lot of science that's going into it. And again, it begs the question, do I wait 20 years for that science to catch up with my need at 40 now, or do I start treating myself now? And I think people whose livelihoods depend on their ability to perform at an extremely high level tend to push the envelope faster. So I'm talking about our professional athletes, our professional bodybuilders, people who are Olympic athletes. They're really looking for that minute competitive edge, like you and I talked about the other day, that they've trained themselves to such a high level. What's going to push them to that next little minutia that's going to get them the gold medal or win them the championship? And those are the folks who have really kind of laid the blueprint for us normal folks who just want to feel like we used to.
Yeah, I think that, like, on a high level, what you're talking about and what is really cool is that you're a part of this, is that there's a sea change happening in medicine. We're going from a disease treatment society to a health maintenance society. And that's exactly what you're talking about, right?
Yep.
Like, you're trying to help people before the engine breaks down. And I mean, that's a good metaphor too, right there. So, we're like, I don't know, probably 40 miles away from Henry Ford right now, right? And there they have Model Ts driving around. Right there. That were built right at the turn of the century, right? And it's not the same parts in those cars that are driving around, but they've been cared for, they've been maintained, and they certainly weren't designed to last over a century, right? But they have. And our biology is no different. We weren't designed to live, hundreds of years. There's a reason we have things like age-related disease now. That's a pretty new term, age-related disease, because you used to die from infection. Mm-hmm. But now we live long enough to we're getting things like cancer and cardiovascular disease, things like that. This is a new occurrence because technology has given us the ability to have these horrible things. But if we can start treating ourselves, if we like we do a classic car, and with the same sort of affection we treat our technology with, and like changing the parts and doing things like you're talking about with hormone replacement, and I'm sure you have a whole bag of other things that you can do to help people. Like, and by the way, I would love for you to be my doctor, but. That's where we're headed, is in a health maintenance direction and not a disease treatment direction. And physicians like you are at the forefront of that. And I, for one, you mentioned, like, are you going to be one of the ones that wait? I am not.
Yep.
So, okay, here's my skeptical take on this side of things.
This is why our friendship works. Is you shoot holes to bring me back to earth.
So hormones are so complicated. They're affecting so many different cell types, doing so many different things. And if you talk about growth hormones specifically, everybody's interested in living forever. Since, mythic stories have always been talking about the fountain of youth and living forever. And it's always a part of our drive. Nobody wants to die. Nobody wants to get old. Nobody wants to get sick. So obviously the draw is there, the drive to figure this stuff out. But if you look at growth hormone, the one thing so far they've found to extend life in mice is caloric restriction.
Yes. Yep.
And they found that the decreased generation of free radicals and oxidative stress is the mechanism by which they live longer. And if you also give drugs like metformin, you decrease the oxidative stress. And what metformin does is increases insulin sensitivity. Right, so if you measure insulin-like growth factor in these mice, it's lower because the insulin is more sensitive, so it drops that down. It's able to bring in the insulin-like growth factor into the cells more efficiently than somebody who has diabetes, for example. Right, so basically the one thing we've shown to be able to keep things living longer is to get the insulin-like growth factor lower. And we have growth hormone deficient mice that die younger. We have humans that have mutations in their growth hormone receptors that live longer, right? So it seems to me there's a trade-off with growth hormone where when you're young, you need it to grow and to form your physiology, your anatomy, to develop. But then when you get older, it starts to decline. And we associate that with the negative parts of aging. So it makes sense, well, let's just give more growth hormone and to reverse some of that trend. But it's also possible that that same growth hormone decreases as a protective measure to slow down the aging process. So you may be trading off more vitality but a shortened lifespan, which maybe for some people that would be okay. But
so shortened lifespan or typical lifespan? That's what I guess I would, because that's exactly what I was going to say. Respond to you with was, so caloric restriction, decreased growth hormone, longer life.
Right.
Meaning you're extending someone's normal lifespan longer.
Right.
Is that quality? Does anybody want a longer life that lacks quality? So what if you kept growth hormone at its normal level? I guess your assumption is you're shortening life, or would you just be keeping it where it would have been otherwise, and that you're keeping that quality at a higher level?
I guess you could say that once we have the science to be able to measure these parameters, and when we know what is the optimal insulin-like growth factor 1 to monitor or something like that, and that's just one thing. Who knows how many other things growth hormone's doing that we don't know about? If you could find some optimal level where you're the sweet spot of slowing down aging as much as possible, but also promoting regeneration as much as possible, sure, that would be hypothetically where you want. But my only point is that it's so complicated, and it seems to be a fairly direct connection with growth hormone leading to with these issues with lifespan, that it's something that you really have to think about. How willing are you to risk a shortened lifespan to play around with the vitality of your existing years on the planet? And it's one of those things that everybody feels different on the spectrum.
It's a worthy argument to make. It's definitely something to consider and to counsel patients on. We don't know what the 30, 40-year results of using growth hormone are going to be if you start at age 40. Is that going to change your end date, your expiration date? We don't know. It could shorten it. It could lengthen it.
But there's no science suggesting it would lengthen it. All the science suggests it would shorten it, which it doesn't mean that you take growth hormone.
I don't know the science well enough to say that there's no science that suggests it would lengthen it.
I don't either. I just said that to make my argument sound better. But I do know that there's a lot of science showing it shortens your life, both animal models, human models. And it's just so complicated, I mean.
Look, when it comes down to like quality of life, I think it's pretty darn important, right? So if you can improve that, that's great. I think that, to your point, in what's proven right now to extend healthy lifespan, if I were a physician and I'm not, the first thing I would counsel people, and I should probably take my own advice here, is caloric restriction, is to get your diet in line. There are things we know that lead to longevity and support it. And like you said, caloric restriction is one of them, for sure. Eating maybe like a third of what you're supposed to eat on a daily caloric level will lead to longevity in animal models, all the way up to rhesus monkeys. They have studies going. It's not just in mice. So I think start there.
Yeah, I can't even do that. So, but then again, like, it's a trade-off. Like, the best way to restrict your calories is to sit on the couch and not move, because you generate an appetite and a caloric demand by the more activities you do.
Moderation.
Right, so it's finding that balance, and that's why I think they find some studies with like long distance marathon runners, extreme sports, that there's some suggestion that their lifespan is a little shorter. I don't know enough about that to really count on it, but there's some suggestion that those extreme endurance sports are not necessarily healthy for your longevity. I don't know if that's really
I'm not a nutritionist, and I certainly don't know, but I think that intuitively it seems like running marathons is probably not the best, but maybe running half marathons not so bad.
Yeah.
I have no idea though.
And drinking beer and watching football.
Drinking beer and podcasting is probably really healthy.
Yeah. So I just have to keep having guests on that can tell me how to live longer and better. And
I like the idea of a follow-up. I like the idea of a
Hey, I'm moving back to Michigan. I'd be happy to come back.
Yeah? Oh, you
So
don't live in Michigan now?
No, I live in North Carolina.
Okay.
I live in Chapel Hill. But I mean,
what brings you into town?
Our company's headquartered in Ann Arbor.
Oh, okay.
And so I'm moving back to be closer to the headquarters. My wife we moved down there because my wife's just finished a residency in dermatology at Duke. So we were down there for that.
Okay.
For, a few years.
Cool. So who's your team you're watching today?
Michigan is who I would root for, yeah.
Who are they playing today?
I don't even know.
Rutgers. Are they playing? No, that was their last.
Here's the reality. I have 3 kids. I have a growing company. I haven't watched an athletic game in years, but my friends are all gathering to do it, and so I'm going just to see my buddies.
Nice. Are you going to Ann Arbor today?
Yep.
Oh, nice.
Yep. Yeah, right after this. So.
Is it a Michigan home game?
No, it's away, actually, and I think it's a later game, if I'm not mistaken. Yep.
It's kind of nice. Home games is just so crazy.
They are. The town gets nuts. But, I mean, I'm pretty used to it. I grew up there, and then now we're living in Chapel Hill, which is another college town. So I've never not lived in a college town. I would never not live in a college town,
really?
actually.
You like it?
Yeah, I do. A lot.
Seems to be a good mix.
It's good energy.
Yeah.
And as someone who started, this business, you can find really smart, capable people at the beginning of their careers, and, it's good for...
Oh, yeah.
And a lot of people wanted to, we have a lot of our companies invested in by, people out of Silicon Valley, and there's a lot of pull for us to go out there as a company. A lot of the partners we're working with on the scientific side are all out there too. But there's just something great about Michigan. I mean, there's really smart people here. And the reality is like, everything's half as much money. It's so expensive out there, so we're gonna stay put.
Cool.
Yeah.
Well, I think we could wrap it up here. Any of you guys want to say anything before we finish up? I appreciate you coming over and doing this.
I really enjoyed it. It was like one of the most fun ones I've ever done. So this is
Have
cool.
you done a podcast before?
A lot of them, yeah.
Oh, really? Cool.
Yeah, and they never have beer, man. So I appreciate it.
Yeah, no problem.
One thing I would end with is, sort of our tagline at Forever Labs, which is, your stem cells will never be as young as they are right now. And it's just a fact. So if you're interested, go to foreverlabs.com and reach out to us, and we're happy to talk with you about storing your stem cells. And if you're in Michigan, see Dr. Tom Nabity.
Yeah, there are certainly lots of providers. Their website does a nice job of you selecting your provider, which provider you want to see. But it's just a great investment in your future of health.
I second the suggestion of Dr. Tommy. He's a great doctor. You're taking patients, right? You're on this new venture.
Yep.
And you want to maybe say how to the millions of listeners
That's right.
how they get a hold of you?
So my office is located in Rochester Hills, Michigan. which is north of Detroit, one of the suburbs. And you can get all our information from our website, www.mcfrm.com or regenerativemedicinemichigan.com.
Awesome. You want to go get lunch, watch the football?
Yeah,
downstairs?
for sure.
All right. Thanks, guys.
Yeah, thank you.
Well, maybe I was a little hard on myself in the intro. I don't know. But for an update, I did have my procedure done. It did not hurt that bad. It was probably a 4 as far as pain with the aspiration, the bone marrow aspiration. And the shoulder injection hurt for a couple days, but it stayed 3 now and almost back to normal. So excited to see how it's going to go. I hope you guys enjoyed the conversation. And the next podcast I have coming up is with a philosopher at Central Michigan University about the book Denial of Death and the writings of Ernest Becker, which was originally going to be number 5, but it got delayed. So until then, have a good one.
Where is